For the first 2 weeks, it feels great. My body's compensating just fine. And then I hit week 3 and 4, and then it's just like, sorry, man, we've hit our max capacity and we're not going to do this for you anymore. Welcome back to another PT Pro from the Optimal Body Podcast. I'm Dr. Dom.
I'm Doc Jen.
And today we're going to be talking about overtraining syndrome. What might I be feeling? How do I know if I'm overtraining? Stick around. Overtraining. How do I know that the amount that I'm progressively overloading isn't too much and going to be negatively affecting my performance? But before we really dive in, anyone out there who is watching, please make sure you subscribe or hit the bell over there, because then we can alert you when we come out with new PT Pearls on all the different topics. We're over 100 of these of so many topics you can go back and listen to, but we have many more to come. Now let's get into overtraining syndrome.
We have done a podcast episode on the difference between muscle soreness and pain that I might feel when I'm working out. So go back and listen to that episode if you missed it, because we really go over the tools and tips that you can do as well to kind of reduce that soreness. Those tools and tips actually play a role into what we're talking about today.
Because progressive overload is something that a lot of people will be familiar with, especially if you're in the exercise science world, or if you've exercised in general. You may have heard like, hey, we need to have progressive overload, meaning we need to do slightly more than before, challenge our system, challenge the muscles and tendons, nervous system, all the tissues to then grow after that session. And once they grow and recover, we might be able to do slightly more. And that's something that's necessary in order to progress our training, to get better at a skill, to get better at any sort of physical task. But of course, we can take that too far.
And so then we look at, okay, what is functional overreaching? And that's when we can see that after about 2 weeks, we see this decrease in performance, and then it's followed by we overcompensate by trying to really up the ante in our performance.
Our body's like, okay, we need to be able to recover. So we might be training slightly past our threshold for our normal progressive overload, but our body's like, I'm still going to try to compensate. And you may notice these performance gains, which is kind of tricky, because if you're noticing that for 2 weeks, like, hey, I'm performing better, I'm still feeling pretty good, it's going to be tough to stop that trend. But then when we get into 3 to 4 weeks, then we get into this non-functional overtraining, where we notice, okay, now I'm not recovering, I'm seeing more of a decline in my performance, and I'm not quite recovering enough. So it's this fine line between, like, for 2 weeks, you might actually notice a gain in performance. This kind of reminds me of sometimes I'll make goals to say, this last month, my goal is to do 100 push-ups, 100 squats, 50 dips, 50 knee raises, and 25 pull-ups every day of the month. And it feels great for a few weeks. And then I hit week 3 and 4, and then it's suddenly just like, ooh, I'm getting all these different aches and pains in my shoulders, and like the dips, I'm noticing, it might be a little too extreme for my shoulders. Maybe I put myself into a place where for the first 2 weeks it feels great, my body's compensating just fine, and then I hit week 3 and 4, and then it's just like, sorry, man, we've hit our max capacity and we're not going to do this for you anymore.
And you start decreasing that performance no matter what you're trying to do.
Every morning when I wake up, it's like, man, this was easy the past 2 weeks, and now it's getting tougher and tougher every day.
Which is the complete opposite of what should be happening if you're actually progressing in a way that your body is getting used to. Over time, you're going to see that, oh, it's actually easier. I can do a little bit more weight. This is becoming more natural, rather than where you probably all of a sudden just read out the gate all these high numbers, didn't allow your body to really progress into that. Didn't give your system any progression at all. It was just like, here we are. This is what we're going to do.
I should have maybe given a rest day between, or started out with half of those numbers.
Exactly.
Which is, bottom line is, when we get into this area of overtraining syndrome, so many different things can happen in our body. It can almost affect every system of the body. Like, yes, you'll start noticing lower muscular output. You'll start noticing that your physical output is going down, but that's for a multitude of different reasons. Like, we can be seeing different hormonal imbalances. Our body's going to be having a lot more of the inflammatory type hormones, and we're not going to be recovering nearly as much.
Everyday person might be overtraining because already our body is usually running at a higher stress level, especially if we're really focused on work and trying to get a lot done there. And then we come home and we're trying to get a lot done there. And then we're going to work out and we're going to CrossFit every single day, or we're doing things that really overstress our body over time. Or we set these really intense goals of like, I want to be at a certain weight, so we cut calories a lot. And when you're cutting calories and not supporting the fuel that you need for all of this training, all this stress, all this work that you're putting on your body, well, then all of a sudden we can start to get into this overtraining syndrome again. So all of a sudden you might be noticing, that you're taking in these fewer calories. It's affecting your body. You might be ideally getting to this weight that you think you're at, but you might actually be losing performance. You might actually be losing strength, maybe even putting on some body fat.
Yeah, that's because of a lot of these hormonal issues. Like we can notice any degree of sleep disturbances.
Yeah.
Our mood, you can become irritable, angry, anything like that. You'll have just like odd midday crashes because you won't quite have energy. Having a high level of cortisol in the body can promote storage of body fat.
Mm-hmm.
So sometimes our body might start actually taking energy from different places like our muscle tissue and then storing excess energy at the end of the day as fat. It can affect our immune system. We can have blunted immune responses, especially because of heightened levels of inflammation that are just sticking and floating around the body. I know our serotonin response, so literally our ability to feel happy, that happy chemical starts to get blunted a little bit too.
Yeah, so you'll become a person that no one wants to start to be around. Triggered by any little thing, starting to get angry, starting to get responsive in that way. And you really increase your risk of injury. Your sleep might be disrupted, which is a part of recovery. So if you can't sleep well, you're not recovering very well. And then you're not adding in extra recovery practices because you're trying to overtrain and trying to just get to the goal of whatever you think that is.
Yeah, and I think that one difficult thing is that people who aren't doing this for like a living, if exercise and physical performance isn't your job, all the stuff that we just listed off is really tough to track,
right.
To be conscious of tracking, even sleep. Like, yes, you can kind of get an idea of when you go to bed and when you wake up every day, but you don't know the quality of that sleep necessarily. There's been quite a few research studies done on it called the acute to chronic workload ratio, where how much have I been doing over a month? What's the average amount of work I've been doing over a month, right? What's that number? I've been working on a scale of 1 to 10. I've been doing 5 for the past month consistently. If all of a sudden I jump up to 8 in the next week, that's too high. You have to be within 80 to 130% of what your monthly average is. So if all of a sudden in 1 week we're running 10 miles and we jump up to 13 or more, that's greater than 130%. So you might be putting yourself at risk of injury.
It's so important to just start to note. So even if you're just starting to write things down, starting to track things, getting a journal, maybe you are starting to lift more, maybe you're starting to run more, and understanding, because 1 week you might feel really good and like, I can go for a while, but you're pushing your body in a place that's not necessary. And we always have to look back at like, what is the intention? Is the intention to just go based on what I'm feeling for the day? Or is it really to work toward bettering my health over time? And if that's really what we're trying to do when we're trying to work out and take care of our bodies, well, then we actually have to be paying attention a little bit more to how we're taking care of our bodies.
This amount of distance today, it took this much time and it felt this hard. Like that number, if you just keep a track of 1 to 10, it felt this hard. That can kind of indirectly keep track of a lot of things. Like, how have I recovered? What was my sleep and recovery like? Because if I ran this same distance on 2 different days and it felt really hard one day versus really easy another day, especially if you run like the same route, then you can start to think back and try to associate, maybe I ate this, or maybe I didn't eat enough. Maybe I didn't sleep well enough. And you can start to think back based on the timeline, why may have this run been so much harder?
That's where establishing your baseline, becoming aware of what your body's natural patterns are, and understanding where you're working out and putting those workouts in, and where you're actually adding in the recovery. And that is the number one thing that gets looked over all the time, and why people join things like the mobility challenges that we do, because they want that extra accountability to actually doing the mobility. It's like, well, I only have this little hour break to be able to get my workout in, which includes going to the gym, getting everything ready, going and working out, and then coming back. So it's like we're not prioritizing recovery enough.
It seems like overwhelming to say, okay, I'm going to track my calories, my sleep, how much I'm doing. I'm going to check out my heart rate variability, which we didn't even mention, rate variability and how overtraining affects our heart recovery. It's massive, and heart rate variability is another big key marker that different devices use to help understand how someone's recovering. But tracking all that can be overwhelming. So let's start with sleep. I'm going to wake up in the morning, write down how many hours I feel like I slept, and how do I feel about it?
Actually, this is not a promotion, but we have been wearing the Oura Ring. Well, I think is actually really cool. Not only is it tracking things like heart rate variability, it's automatically tracking your sleep, but it's also, kind of looking at body temperature. So for a woman, especially who's going through hormonal changes every single month, it's really cool to be able to see where your body's at and how that might be affected based on your cycle and your heart rate and all that kind of stuff, your recovery. I wouldn't say it's to go based off solely like, when should I work out? When should I recover based on this app, right? But it will bring you into that awareness. Like, hey, your heart rate's not coming back. It's not really stabilizing after you work out, or it's staying really high, or having those decreases and you feel like you're not progressing in your workouts. You feel like they're actually regressing and maybe you're gaining the body fat that you're trying to push off. We need to be thinking of adding these recovery techniques back in. They get into crazy trends sometimes, right? So it's like, I'm only gonna do fasted cardio, or I'm only gonna do where it's sometimes you gotta play with it. You have to see what works better for your body, and there's no one size fits all. And making sure that you're fueling your body for your workouts is so incredibly important.
Any changes in your sleep, food, recovery time, like breath work, stress reduction techniques like journaling or breath work or anything like that, can make a massive difference. Thanks for joining us for another PT Pearl from the Optimal Body Podcast. If you had any questions or thoughts on what we talked about, comment below. Please think about subscribing or hitting the bell so you'll be notified whenever new PT Pearls come up or when some of Doc Jen's mobility videos air. And of course, we'll see you next time on the Optimal Body Podcast.